Good day. We are the group of Almario, Biscocho, Dumasis, Lapus, and Makatuno, and we will be presenting our poster on the topic of encephalocele. Encephalocele is a rare congenital neural tube defect that occurs when the top of the neural tube fails to completely close, causing the brain tissue and other associated structures to develop abnormally through an opening in the newborn skull. Essentially, it is a sac-like protrusion of brain tissue that extends through an opening in the skull. Moreover, all cephaloceles retain some sort of attachment to the brain by a cord or stalk of tissue, and this can be further classified according to the type of matter inside the protruding bulges and its specific location in reference to the skull. Studying encephalocele, a neural tube defect, offers valuable insight into the intricate process of neural tube closure during embryonic development. It highlights the critical role of proper neural tube formation in giving rise to the brain and spinal cord. The underlying mechanism and risk factors associated with encephalocele allow for a better understanding of normal neural tube development while identifying ways to prevent and treat such condition.
Aside from the decreased overall quality of life, the effects of encephalocele also include physical impairments like cerebrospinal fluid leakage from the ear or nose, buildup of fluid in the brain, also known as hydrocephalus, recurring seizures or headaches, complete loss of strength in the arms and legs, uncoordinated movements, and intellectual limitations. There are also corresponding sensory impairments like nasal obstructions or issues with vision, which are further influenced by the location of the bulges. These facial abnormalities also pave the way for possible psychological challenges that are brought about by social stigma and emotional distress. It is possible to monitor this anomaly as early as the mother's routine prenatal ultrasounds up until visible observation of the bulge during the birth of the infant. Postnatal imaging scans are also done in order to assess the severity of the defect and confirm the type of encephalocele based on the sac's content.
Encephaloceles can also be classified according to the location of the skull's opening, which are generally divided into anterior and posterior encephaloceles that respectively reside towards the front or back of the baby's skull. A few specific examples of this are the following. Frontal encephalocele refers to the sac that protrudes near the baby's forehead through the frontal and ethmoid bones. Nasofrontal encephalocele is that which protrudes through the nasal and frontal bones. Occipital encephalocele is characterized by the brain tissue protruding through an opening at the lower back of the baby's head, and this is the most common form of the disease. Other types also include parietal, orbital, and nasal encephaloceles, whose sacs develop through openings in the parietal bone, the orbital bone near the eyes, and the nasal plate near the nose, respectively. The nasal and nasofrontal encephaloceles can also be further differentiated in that the former has a relatively smaller bulge than the latter. The understanding of this disorder becomes increasingly important as there is a higher prevalence of this disease in Southeast Asia, where the Philippines is observed to have a case of encephalocele in every 3,000 to 10,000 live births. The Centers for Disease Control and Prevention estimate that this disease has a mortality rate of 45 to 55%, which varies based on the size and location of the protrusions. Despite being one of the top 10 birth defects in the country, encephalocele response has been limited by insufficient resources, financial constraints, and a lack of surgical expertise.
To expound on the causes of this illness, it is important to note first that normal human brain and spinal cord development has different stages, and this includes primary and secondary neurulation in the embryo, which occurs during the third to fourth week of pregnancy in humans. Closure of the anterior and caudal portions of the tube occurs in these stages. Cranial neural crest cells contribute to the formation of the craniofacial skeleton and nervous tissue, and these are regulated by several genetic pathways shown in the screen. Sonic hedgehog pathway and bone morphogenetic proteins are integral to the growth of the neural tube, and these pathways signals from the notochord establish the ventral portion, while WNT and BMP signaling from the roof of the neural tube establishes its dorsal aspect. Gli transcription factors and G protein coupled receptors are essential for the regulation of the sonic hedgehog pathway, enabling functional signal reception and successful intercellular local transduction and neuronal migration during the neural tube development. Furthermore, these transcription factors are critical for closing pattern of the neural tube. When disruption of neurulation and improper mesenchymal migration occur, neural tube defects like encephalocele
The
arise.
specific causes of encephalocele are not definitively identified yet, but it is likely dependent on multiple factors such as genetics and fetal environment. This condition is mainly associated with the corresponding family history of neural tube defects, where encephaloceles are prevalent among families with a history of spina bifida and anencephaly. Deficiency in folate or vitamin B9 can also contribute to the prevalence of this disorder, considering that folate is essential for the progression of the fetus's neural tube and the development of its nervous system. Exposure to alcohol, drugs, tobacco, and infections are also possible causes of this defect. Maternal health conditions such as diabetes have also been connected to this occurrence. Preventing encephalocele begins with proper prenatal care, including a folate-rich diet, which has been shown to reduce the risk of encephalocele. Whenever it occurs, treatment is possible through surgical intervention to repair the defect and protect exposed brain tissue. Following surgery, rehabilitation therapy plays a crucial role in helping patients recover, improving motor skills, cognitive function, and enhancing overall quality of life. With early intervention and comprehensive care, individuals affected by encephalocele can still lead fulfilling lives despite their congenital defect.